Hello and welcome to the presentation of COVID-19 response learning piece findings. My name is Justine and I'm just going to talk you through the key findings that we found during this learning piece. In the COVID-19 pandemic, the Alliance provided technical guidance, support to countries, agencies and nutrition practitioners. It was the first major crisis that the GNC Technical Alliance responded to since its formation. We decided to do a learning piece in order to take stock of what the actions the Alliance undertook during the COVID-19 response were, what were the challenges we faced, what were some of the successes, and what were the perceived values of these actions. We wanted to do this in order to inform ways of working going forward and to ensure that we are engaged in a process of continual learning, improvement, and also getting feedback from others. In terms of the methodology for this learning piece, there were two main parts. The first was to do a desk review of the activities and products that were developed by the Alliance during the COVID-19 response. And the second was to do key informant interviews with key actors involved in the Alliance and people who use the services. So this included members of the Alliance's leadership team from UNICEF, IMC, World Vision, the GNC coordination team, and ENN. It also included a country nutrition cluster coordinator and a member of the Global Thematic Working Group and PAT teams. We had hoped to be able to interview some practitioners and field level users of the Alliance's products, but I was unable to identify anyone who wanted to participate in this learning piece, and therefore that level of feedback is missing from this learning piece in part. So let's get into what we did. So in terms of the GNC Technical Alliances response, we launched a website in April 2020 that had a dedicated COVID-19 resource page. The Tech RRT, which is now the TST, hosted 20 webinars between April and November that had a COVID-19 focus, and these were attended by over 4,600 people. And from registration papers, we see that at least 21% of these were from national or local NGOs. And the number of people who access these webinars may be higher, as we only counted one registration per login. And so if more than one attendee was on a computer, that isn't reflected in this number. And if there were multiple people watching from one screen, this also wouldn't be counted. ENN hosted 5 podcasts on how programs were being adapted to consider COVID-19 that were listened to over 2,500 times. These covered 5 areas such as adaptations in Nigeria, family MUAC in Ethiopia, and looking at growth monitoring and promotion in Burundi. The Alliance also contributed to the development of a number of briefs on key areas such as management of child wasting, infant and young child feeding, maternal diets and nutrition services, NIS surveillance and monitoring, and guidance on financial and in-kind contributions in the food and beverage industry. Some of these briefs only had one iteration, where others had multiple. And based on the GNC survey findings on the adaptations of COVID nutrition coordination from July last year, we could see that the majority of clusters were aware of and were using the guidance. And this information had been previously presented by the GNC, but also in our launch webinar last year. But I think this shows right now that there was a good awareness of the briefs that were coming out from the Alliance and a relatively high level of uptake. And this may have changed after July last year and increased more, but this is the snapshot we have from then. In terms of providing technical support, support was provided to 10 country clusters, supporting them in adapting the collective nutrition response plans and preparedness plans to COVID-19. Ongoing IYCFE support was provided in Venezuela and Ethiopia, as well as remote technical support specific to COVID-19 provided in Myanmar, DRC, Afghanistan, South Sudan, and Somalia. One of the main actions of the Alliance was to respond to and coordinate a response to questions that were coming in. So Between March and June last year, 120 questions were received that covered unique topics. So these covered questions on IYCF, management and prevention of wasting, NIS, and other questions. Other questions here represented cross-cutting themes related to nutrition. And we can see the Global Thematic Working Group on Wasting would post their responses to some of the questions related to their sector on ENNet. And by just looking at the responses that they provided to these questions, you could see that for each post that they made, which was 20, there was an average of 901 views per post. And this ranged from around 550 to 1,250 views per post. And I think this shows a keen sense of interest in the technical answers and responses that were coming out of the GTWGs. We also provided a consolidation of programmatic adaptations for COVID-19 for the prevention and management of wasting, nutrition for infant and young children, and nutrition information systems. And these are available on our website. Now, I'm going to jump into what challenges we faced. What were some of the challenges that we faced and encountered during the response? And here the questions were really looking around, where did we fall short? What challenges did you experience? What didn't work? And what could be improved next time? Challenges were presented from participants in two ways. One was challenges that were experienced during the response, but the participants felt had been resolved, and challenges where they felt there was not a clear solution yet. And so I've grouped these challenges into three categories: those that are related to the process challenges, technical guidance, and outstanding issues. I'm going to start quickly with the challenges where participants expressed that they felt solutions had been found. So I think during the interview process, one of the main things that came out is the challenges that were being experienced by the Alliance were more because COVID-19 was unlike any emergency that had ever been encountered. The sheer scale and global impact of it was unprecedented. And coupled with this, the Alliance was in its startup phase. And so we had limited internal processes and systems in place. And this caused confusion about some of our workflow processes and how we operated as an organization. What was stressed here is that these were mostly operational challenges, and it reflected the newness of the mechanism. These did not stop the Alliance in its response, but it meant that some things took a bit more time than they normally would have, and there was less efficiency. So this was also compounded that things were changing very quickly during the start of the pandemic, and we didn't have a lot of systems in place. People really felt that a lot of these issues had been resolved through the development of new structures and process issues, and a new design of the Alliance and development of standard operating procedures, which allowed us to develop more response mechanisms internally. I think one of the more specific challenges where this newness came out and was specific issues around the PATs. So there was a feeling that some structures and mandates of the Alliance weren't clear, and this was really clearly seen with the PATs. So even in the process interview, it was clear that some respondents weren't completely clear on the purpose of the PATs and saw it as a mechanism for answering questions from the field rather than a mechanism of consolidating programmatic adaptations. However, for the most part, people felt that there was clarity was brought around the PATs through the developing of a standardized TOR for them, by having a leadership team member, namely Yara, sitting across all of the meetings to be able to answer people's questions as they came up and direct them to give them any answers that they might require. And there was also a suggestion that came out was to pre-position PAT structures for future responses so that PATs knew what their purpose was and mandate was before they were activated. Another challenge that came out, which was really a process issue, was just around the instability and changes during the leadership at the start of the response. But many people felt like this had been stabilized and solidified under both Saul and Megan coming on board respectively as the co-lead from UNICEF. Another issue that came up was just managing the huge amount of questions that were coming in. Someone described it as we were just bombarded with questions, and this really reflected the global scale of the pandemic, and that we were receiving questions from every corner of the earth, and it wasn't just a localized response. People felt that setting up of the activation of the GTWGs and establishing PATs to handle questions and adaptations was a real successful way of managing this, but it still presented a challenge just due to the sheer volume. Another challenge that people faced at the time was just a lack of scientific evidence around COVID-19. If you think back to the beginning of the response, there was so much that we didn't know just on a basic scientific level around the disease and how it spread and what some of the health impacts were. The way that this was handled at the time was really relying on WHO guidance and also feedbacking gaps to the WHO and other stakeholders to show where information needs were and where technical guidance was required based on some of those questions we were coming in. So in this way, it was felt that that challenge was overcome. So the challenges here are those that experience that people felt that there was maybe no clear solution or resolution expressed. And so I'm just going to talk through these now. So in terms of processes, there was a feeling that while we were really quick to get out some initial briefs and guidance, providing technical support, we might have been a bit slow to amend these briefs and guidance. And there was a recommendation that we maybe set a clear timeline of how frequently and often these briefs are updated to ensure that they continue to remain relevant. There's also a feeling that the programmatic adaptation docs could have created parallel information sources to the briefs, and that perhaps we should have looked at combining information coming out from the programmatic adaptations as well as the briefs to centralize where information could be found. There was also a feeling that from participants that were not sure how the Alliance should deal with controversial issues. So one issue at the time was the recommendation around moving to MUAT from weight for height. And there was just a feeling that there could have been a better way of having this conversation both internally and externally. And there was also, not just from an internal perspective, but from a user perspective, and ask for more clarity around guidance on how to navigate these issues at an implementation level, which I'll touch on a bit later. Another issue came up around the institutional responsibility or partnerships with other agencies, and a feeling that sometimes these were not always pre-established and not clear. So one example that came up was a feeling that sometimes the WHO was often missing from coordination calls. And this led to some issues not being able to be quickly dealt with, or leading to an unclear process of when and how to get a response that led to delays in providing technical information. A recommendation here was to ensure that institutional responsibilities between the Alliance and other key agencies are worked out in advance so that we have a clear idea of who and when and how agencies will work together and what expectations are of each partner. In terms of technical guidance, there was feeling that sometimes guidance was not always applicable or easy to adopt to specific country contexts. Sometimes the guidance we gave was more theoretical than practical. And there was also a feeling that sometimes that guidance was just dumped back to users, and then the user had to navigate and decide for themselves how they might apply this guidance to their own context. And there was a recommendation here that we could maybe try to work to present the guidance in a format, such as a decision tree, that would allow countries or users to be able to look at the recommendations and adopt them more easily to their context. And it was really stressed here the importance of having the end user in mind when we consider recommendations, to think about the feasibility of these recommendations and not just provide a theoretical answer. Additionally, there was a feeling that the feedback loop to responding to technical questions wasn't always clear. Sometimes it was hard to assess if answers to questions that were coming into the Alliance were getting back to the right people and whether these answers were meeting their needs. And another issue that was highlighted was that there was limited multisectoral engagement, and there were challenges in dealing with questions that were coming into the Alliance that didn't fit neatly into a nutrition sector. And there being a lack of clarity on how do we align our technical response with the technical guidance that was coming out of other sectors. Next, we went on to discuss gaps, looking at was there something that people would have liked to see developed or available to them from the Alliance that wasn't during the COVID response. One thing came up here was a request for guidance on how to estimate the impact of COVID-19 on the nutrition sector through needs assessments and analysis. And while we recognize that it might take a long time to be able to fully estimate and understand the impact that COVID-19 has had on the nutrition space, this was a request that was coming through at the time, and it was something that the Alliance was unable to deliver on. Another request coming in was for more alternatives or guidance on how to understand weight for height versus NUAC, and information to help better understand the limitations and benefits of the different approaches and how to respond. And this was coming up because there's a feeling that within the sector, there's a lack of clarity on how to navigate this space. And there was a request to have more guidance to help cluster coordinators and organizations understand what might be best for their context. Another question or request that came out was for more guidance on how to practically apply the recommendation that was made to use historical trends and data as an alternative for weight for height in NIS. It was mentioned that this has now been resolved through smart guidance on how to use population-based surveys for this issue. However, at the time this recommendation was made, and there was a feeling that there was no guidance on how to actually practically adopt this recommendation. And one last gap that was identified or request that was made was around easier to understand guidance on when and how to resume anthropomorphic measurements. One suggestion here was made to provide or create a decision tree that could be used to navigate the different scenarios in each country context. Now I'm going to go to successes. So the first was that this looked at how coordinated, accessible, and timely was the GTAM or the Alliance's response. What worked well? What did we do well? What would you like us to keep doing? So the first thing is that overwhelmingly people felt that the Alliance's response was timely, accessible, and coordinated. And there was a number of successes or strengths that were specific to the leadership team that people mentioned, and I want to pull out here quickly. So there was a feeling that there was really good coordination between the GNC CT, the Alliance, the Tech RRT, and that there was a good coordination and support provided to incoming requests and needs. That having the leadership team members sitting across all of the GTWGs and PAT for integration between the groups and the Alliance. And it was also recognized that the Tech RRT quickly switched to a remote modality of providing remote support and remote work and support, training advisors, providing online learning and TOR development, one-pagers, and remote support. So there was also a feeling that the Alliance provided quick and timely response and adapted to meet the needs coming from the field, whether this be through the quick launch of the website, answering of questions, writing of briefs, providing technical guidance, remote support, and training. The feeling was that this was all done in a quick and timely manner. As mentioned, there was a feeling that there was strong oversight, communication, and coordination. And one thing that was mentioned by many people was the weekly coordination calls that were headed by Saul. They felt that this was a really open and warm community that allowed everyone to speak and for a platform for questions to quickly be answered and issues to be raised. It was also acknowledged as a success was the quick development of recommendations and guidance by the Alliance, of identifying where guidance was needed, being able to help accelerate the process of guidance development, and filling a gap in technical guidance until comprehensive guidance was available. There was also a feeling that the webinars on COVID were really quick to start. The first COVID webinar hosted by the Tech RRT was in April, and there was a quick shift to providing multilingual delivery of the webinars to increase accessibility. Another success was seen as including practitioners in the process of developing responses and guidance to ensure that it wasn't just done from a top-down approach, but there was also that inclusion of practitioners. In terms of our value and the perceived value of the actions of the Alliance, so there was a feeling that the Alliance was fit for purpose. It provided timely, accessible, and coordinated response to the COVID-19 pandemic. It also created a positive and constructive platform for open collaboration across the sector. Someone described this as there being no walls. The Alliance also allowed for rapid dissemination of up and downstream communication between different partners and actors within the nutrition space, and there was no need to create a new forum to do this during an emergency response. The Alliance also provided easy access to a network of technical specialists and a platform for coordination in the sector that sped up the response time. There was also a feeling that we were able to develop needed technical guidance to support countries to prepare for and respond to COVID. And I think overall, there was a sentiment that the Alliance did exceptionally well in the face of an unprecedented global pandemic, and that had such a widespreading impact. And something that really came out was just the way that the nutrition community and people came together to respond to this surge in needs, and that many people put in many, many hours above and beyond what was expected in order to collaborate and work with others to provide support to practitioners in the field. These are some of the quotes of what people said about the Alliance. So one person said, "This one saved my life. It was a gold mine," when talking about the initial resource guide that was provided by the Alliance. There was a feeling that the learning and sharing cafes were brilliant, and that the feedback that we provided was consolidated and showed good collaboration with other agencies. So I didn't experience contradiction to GTAM guidance. It showed good collaboration and consolidation with the UN. Another person said the GTAM and its partners were very useful in the response. I can list a number of guidelines, adaptation tools that were developed that would not have been possible without GTAM. So looking forward, people were asked what needs to be done, how can we keep improving, and what would you like to see from the Alliance moving forward? So there's a request to continue to make sure that webinars, guidance, and support is driven by the needs of the field. There was a request to provide guidance on a country level on how and when to transition back to pre-COVID ways of operating, or how we can continue to operate in a more long-term way in this new normal. There was also a request to continue to improve our engagement and communication in field countries through multilingual engagement by the Alliance, explaining who we are and what we have to offer so that people know of the existence of the Alliance and how they can access support from us when they need it. There was also a suggestion that we should be making a greater investment in preparedness, in training, relationship building, pre-positioning, and supporting early action activities. And I just want to end with a thank you. So these are the main findings from the learning piece. I want to thank everyone who participated, who were willing to answer questions, provide data and information. I just want to thank everyone for participating not only in the learning piece, but also the time invested in the COVID response. I think without all those hours that you poured in and your commitment to the nutrition sector, this would not have been possible. And I'm going to leave you with this quote. So we have turned the COVID response into such an abstract thing, but it was such a deeply personal experience for everybody, because while it was happening to the other, it was also happening to us. There's never been a crisis like that, where you were worrying about your grandparents just as much as you were worrying about the people of Somalia. It showed that at a moment like this, you could still think about the other, and that was deeply beautiful. It makes me really proud. Thank you, and if you have any feedback that you'd like to share on the COVID-19 response, please do reach out to us at the Alliance. We are always willing to learn more and hear what you have to say. Thank you so much.